Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, clinical features of incidentaloma. In the clinical evaluation of incidentaloma, first, diagnostic workup. This is first you will have to identify the patients that would have a benefit if you do adrenalectomy. So this is the main aim. The aim of the patients with incidentaloma is to make sure and to identify those patients who will have a positive outcome due to adrenalectomy. So the workup of this incidentaloma is by doing a hormonal evaluation is done along with the size criteria. You will have to evaluate the hormone and you will have to even evaluate the size of the malignancy. Okay, so you will have to focus whether the patient has any previous history of malignancy or not, whether the patient has any hypertension, or whether the patient has any symptoms of glucocorticoid or sex steroid excess. So all these should be considered. Then we should also do biochemical investigations should also be done. Then, when do you think that there will be a malignancy? Look, a malignancy is common if the tumor is more than 6 centimeters in size and if there is more than 25% of risk of malignancy. If the tumor is more than 6 centimeters in size, then that tumor will carry a risk of more than 25% risk of malignancy is present in that tumor. Then CT guided FNAC. CT guided FNAC, though rarely useful, it can be used for the evaluation of adrenal masses. Then the diagnosis of primary adrenal malignancy is not reliable based on the cytological criteria alone. So diagnosis is not reliable based on cytological criteria alone.
thank you and thank you for watching.